Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, it's estimated that 7 to 10%, possibly up to 15% of the U.S. population suffers from a condition called restless leg syndrome. Now, it's a bit more common in women than in men. Now, restless leg syndrome, also called Willis-Ekbom disease, causes unpleasant or uncomfortable sensations in the legs and can create an irresistible urge to move them constantly. The symptoms commonly occur late in the afternoon or in the evening hours and are really severe usually at night when a person is sort of sitting or lying in bed. And this makes it very difficult to fall asleep, leading to daytime fatigue, lack of productivity, compromised quality of life. And the chronic sleep deprivation can lead to problems with severe depression and anxiety. Now, it's very well documented that low iron levels can cause restless leg syndrome, which is correctable in these cases with simple iron supplementation. But not all cases of restless leg syndrome are caused by iron deficiency or even a marginal iron deficiency. Now, a very important breakthrough study was published in 2015 in the journal called Sleep and Breathing. And it showed that low blood levels of vitamin D can also, which is commonly overlooked, can also lead to restless leg syndrome problems. So this study showed that raising vitamin D blood levels to above 50 nanomoles per liter significantly reduced the severity of restless leg syndrome in restless leg syndrome patients who had blood levels below this value at the outset of the study. So this is important because the drugs prescribed for restless leg syndrome are associated with the potential for addiction and significant withdrawal symptoms. These drugs, the common drugs that are prescribed are gabapentin, benzodiazepines like Valium, and also opioid drugs like oxycodone. So for those with restless leg syndrome, they should really have their blood levels of iron and vitamin D evaluated. If the serum ferritin level is below 20 nanograms per milliliter, or if the vitamin D blood level is below 50 nanomoles per liter, then these nutrient deficiencies should be corrected through targeted supplementation to get these values into the ideal range. Studies suggest that this approach would resolve a large percentage of cases. Now, other natural interventions that are shown to have promise in resolving restless leg syndrome include taking a probiotic and possibly a prebiotic supplement, as bacterial overgrowth, often seen in irritable bowel syndrome, is also a common finding in many cases of restless leg syndrome. Possibly up to 69% of people with restless leg syndrome have dysbiosis, too many unfriendly gut bacteria, not enough of the friendly gut bacteria. And note also that the use of alcohol, smoking, nicotine, and caffeine are known to aggravate restless leg syndrome and thus should be avoided or greatly minimized in restless leg syndrome patients. Now, restless leg syndrome is also associated with other health conditions and factors which include end-stage kidney disease, certain types of neuropathy, and the use of certain medications such as anti-nausea drugs, antipsychotic drugs, common antidepressant drugs like even Prozac, and some cold and allergy medications that contain older types of antihistamines. Also, pregnancy, especially in the last trimester, can produce restless leg syndrome, but it usually disappears within 4 weeks after delivery. So, if you experience restless leg syndrome and you don't have end-stage kidney disease, you're not pregnant or using drugs that I've cited as potential causes of restless leg syndrome, then ask your doctor to evaluate your iron and your vitamin D status. If either or both of these values are low, then get them into the ideal range using supplementation with your doctor's guidance and monitoring. And avoid and minimize alcohol, caffeine, and nicotine, and consider taking a probiotic supplement each day, possibly even a prebiotic supplement to help support the growth of the friendly bacteria in the gut. Now, restless leg syndrome can be a very aggravating, annoying, and life-changing condition that can lead to depression, compromised quality of life, and in some rare cases, addiction to narcotic drugs. So restless leg syndrome patients should be proactive in the management of this condition as much as possible. So I've included the references for this information in the text below. So thanks for watching, and I'll see you next time.